Despite numerous reform efforts aimed at lowering prices and extending coverage, the U.S. has largely maintained a system of healthcare combining insurance agencies and government subsidies. Liberals have consistently pushed for more government involvement, and conservatives have consistently argued for fewer restrictions to allow the free market to regulate healthcare. In many ways, President Harry Truman started our modern debate about government involvement in healthcare. Truman had a 5-point plan to address U.S. healthcare. 1. Curtail the shortage of practitioners in rural communities. 2. Increase the quality of hospitals in rural and lower-income counties with national standards. 3. Create a board of doctors and public officials to set these standards. 4. Create a government option for health insurance in which anyone can buy health insurance from the government if they wish, also known as the National Health Insurance Fund. As he was president during the Cold War era, Eisenhower wanted to avoid any perception of similarity or sympathy to communism. Eisenhower emphasized firmly that he did not want to socialize medicine. However, Eisenhower did support the federal government spending on research and on assisting people to afford local healthcare plans. It's also important to note that Eisenhower emphasized his opposition to any sort of mandated health insurance law. In short, no one should be forced to buy health insurance. The most significant contribution President Johnson made was the starting of Medicare, which provides health insurance through companies to the elderly and the disabled. The system contracts out of private insurance companies to provide health care for these people. It is funded by payroll taxes. He also instituted Medicaid, a similar program that aids low-income Americans in affording health care. All of these reforms were part of Lyndon B. Johnson's Great Society social programs to fight poverty and racial injustice. Important to see how the two parties circle around the issues with their rhetoric and their policy. Reagan continues the Eisenhower vein by strongly opposing socialized medicine. He complained about waste and fraud in Medicare and Medicaid. However, in terms of policy, Reagan did not significantly change the healthcare system. Clinton attempts to change the healthcare system, arguing that healthcare should be guaranteed for every American. He appoints his wife, Hillary Clinton, to lead the charge. The plan included an individual mandate for coverage, and those too poor to afford health insurance would receive subsidies. State healthcare alliances would sell insurance and regulate insurance companies. These alliances would provide direct insurance to mainly the unemployed, self-employed, and those working part-time jobs. The federal government would set national standards of coverage. Bush again sticks to the Republican mold, avoiding any semblance of socialized medicine. He does support more funding for community healthcare programs, increased research funding, enrolling more poor children in healthcare programs. To continue the incentive buying private insurance, Bush proposes a $7,500 tax deduction for health insurance. This was criticized for not helping the poorest Americans, who could not afford to pay any income tax. He also supported using Medicare to pay for private insurance. Notably, he vetoed SCHIP, a program instituted in 1997 by Republicans to provide funding for lower-class children whose families did not meet the poverty requirements for Medicare. Obama is probably the biggest shift in healthcare system we've seen. The Patient Protection and Affordable Care Act, more commonly known as Obamacare, aims to lower healthcare costs and expand high-quality coverage. The Patient Protection section raises standards for care and insurance, most notably forbidding insurance companies from denying people with pre-existing health conditions. It allows Americans to purchase subsidized health insurance. It expands Medicaid to allow all adults into the program in states that opt in. One of the most significant and most controversial aspects of the plan is the individual mandate, which requires all Americans to have health insurance or pay a fine. This ensures that healthy people also purchase health insurance. Healthy people who purchase health insurance subsidize, in effect, health care coverage for the sick. The whole point of the plan was to expand coverage for the lower class and lower healthcare costs. The result of Obamacare has been mixed. Supporters point out the amount of insured people has risen dramatically. However, opponents criticize the fact that healthcare costs and insurance premiums continue to rise. Bernie Sanders' campaign for president emphasized providing healthcare for all. Sanders wanted to build on Obamacare to ensure the 29 million Americans that still do not have health insurance, in addition to the uninsured due to incredibly high costs. Sanders wanted to institute a single-payer program in which federal government pays for all health care with an increase in taxes. All Americans would be insured and receive coverage. On the opposite side of the political spectrum lies anger over incredibly high healthcare prices. President Donald Trump fed off this anger, arguing that his opponent, Hillary Clinton, would simply continue Obamacare as is without solving the problem of rising costs. However, Trump and the Republicans have struggled to provide a viable alternative to the ACA. Their latest attempt, the American Health Care Act, includes the following key points. 1. Insurance companies could go back to charging people with pre-existing conditions for more insurance. 2. The HCA removes several federally mandated requirements for healthcare. And 3. Most significantly, the HCA would get rid of the individual mandate. In conclusion, we stand at a crossroads in American society between differing perspectives on healthcare. Many liberals want to push towards more government involvement in healthcare, towards a single-payer system. More moderate voices want to expand healthcare coverage within the existing system and fix Obamacare's problems. And conservatives want more deregulation to allow the free market to drive down costs.